Hi guys, happy Friday. This is going to be our first lunch and learn of the year. And I'm actually really excited for today's guest, Dr. Amigues. So let me see if I can get her on, give us just a minute or two to figure out all the tech, and then we'll get started with the live. For those that are new here, I do please ask that you sign up for the newsletter so you never miss out on any of the happenings that are going on with me. And hopefully there is Dr. Amigues. Hello, welcome. Thank you so much for being here today.
Oh, it's my pleasure. And yeah, my full pleasure. Really excited
So,
to
Dr.
be here.
Isabel, I'm going to actually hand over the mic to you for just a minute. I want you to introduce yourself to my audience.
Sure.
If you could please let them know who you are, where you're from, and just a little bit of your story. How did you end up as a rheumatologist here in the States?
Wow. Okay. How much time do you have?
I know.
Okay. The first thing that I'm not sure, like the internet seems to be a little iffy. Is my internet?
It's cutting out a little bit.
Is it good?
There we
Okay.
go. That's better, I think.
Hopefully this will work out. I removed the. Okay, so I'm Dr. Isabelle Amigues, and I'm a rheumatologist. So I trained in France. I did everything in France. I finished my rheumatology also in France. And I had met my the dad of my kids, my ex-husband, in India. And because he was in India, he came to the US and he had done a second residency. I told him, hey, why don't you do a third residency? You know, you're becoming an expert at this. And he's like, nope, no more residency.
Yeah.
So I was like, okay, fair enough. So I came to the US, loved it. Actually, it's funny because French people are very, we have a lot of guesses of wrong ideas of what the US is.
Misperception. Yes.
Misperception. That's the word. And it turns out like I just loved it. I love working here. I really do like it. Anyway, so now I'm still a rheumatologist because that's really my favorite specialty in the whole world. I just love what I do. And so I'm now in Denver, Colorado after going through another training in New York City at Columbia University. And so I'm super active in the rheumatology community on the American College of Rheumatology with the COVID rheumatology group that we had. And I just opened my practice of direct care rheumatology in Denver, Colorado. Yeah,
congratulations.
Freaked out.
So my next question to you, which may sound very simple, but I think for a lot of people is a new term, is what is a rheumatologist? What kind of doctor are they?
Yeah. So just so that you know, you ask this question to 40 rheumatologists, 40 of them will give you a different one. So just,
fair enough.
Full disclosure. But the way I describe myself or my colleagues is you take Dr. House and you give it a good attitude. That's how I see myself. Dr. House with a good attitude. Well, so, rheumatologists, so basically the idea is that it used to be that it was joint related, but it actually now encompasses any sort of inflammatory syndrome that's inside your body. And the truth is that rheumatologists love to play detective. And so we are very good diagnostician. And so we try to figure out what's happening as long as there is, if there is inflammation or if there is some things that people don't understand, they usually have to pass for the rheumatologist. And I have to say that most of the time we figure it out. The vast majority.
Say that, you make me think of, have you ever seen the show, it's older now, but Murder, She Wrote with Angela Lansbury? So she has to solve a mystery in every episode. So I feel like you guys are mystery solvers. It's like, when everyone else is stumped, send a rheumatology, see if they can figure it out.
Yeah, no, I mean that's one of the reasons I love being a rheumatologist. It's that figuring out piece that I love. Like then you figure out and then you offer a plan and you're like, okay, we're set now. They're gonna be fixed. Woo!
Yeah, a common question that I get a lot is, what is an autoimmune disease? Like what is that? And sort of how do they develop? Why do some people get it and some don't? And you may or may not have all the answers, but if you can touch on those 2 points, I think it would be really cool.
No, that's a super good question. So so I like history, so I like to bring that down. So right, like so when we were created, like however we were made, we keep getting better, right? Like our prototypes keeps getting better. And the first thing that we had to fight when we were, much more primitive, is that we had to fight infections. And to fight infection, you need an autoimmune system that's basically is going to be able to attack what's wrong, but leave what's right. And so there's this balance constantly in your body of, I call them the diplomat cells. The diplomat cells are here and are checking that the spies are checking that everything is fine, that you're all in balance, and that this infection is taken care of. I mean, we have infection going on all of the time in our body. The moment you eat, there's translocation into your bloodstream, and so there is a little bit of an infection. Thankfully, we don't develop an actual infection. It's just that there is a little bit of
exposure,
infectious agent, exactly, right. And our immune system is there to take care of that. Same thing. I think it's every 8 minutes we have cancer cells that is being made, and our immune system recognizes the cancer cell as not being supposed to be there, so they get rid of them, right? And I think when the best explanation of what an immune system is to realize, for example, when you get a transplant. So if you need a kidney transplant or so on, you need to decrease the immune system. So first of all, you're trying to get a body, organ that's as similar as yours, and then you still need to decrease your immunity, because otherwise, what is that organ doing this? Like, what is it doing here? Okay, so now we understand what the immune system here. It's here to protect us. The issue is that in the evolution, we had to protect ourselves from malaria and so on, right? And then there is this moment where your immune system may override and basically go against you. And that is when you may develop an autoimmune disorder. But so it's really really important to realize that we all have an autoimmune system. And we all potentially could create either too much or too little. Too little, you would get infection, and too much, you may create autoimmune disorder. And so then the idea as a rheumatologist is to figure out what is that autoimmune disorder and why, what are the organs that it may damage, so that you can prevent that, and that you can, suppress the immune system at the same time allowing it to do its job. And so that it's that balance. And we're just, as a rheumatologist, my job is to just help your body get back to that balance that it had.
Gotcha. So if I'm hearing you correctly, we all have a defense system that's necessary for survival. And that defense system has to maintain a certain balance. If that balance is either too little or too much, so either extreme is bad for us. And the too little would be that we get an infection because we're not able to fight it, or too much would be this autoimmune disorder, whatever it is. Okay,
exactly.
That's really helpful.
Exactly right. Yay! Either you're a good student or I'm a good...
No, that's excellent. It was a great explanation. So tell me, in what way can an autoimmune disorder affect fertility?
Well, so there's a couple of answers here. Number one, if you're not in balance into your system, right? Like if you think about it, fertility, it's going to be the best when you're at the balance, right? Like you need to have this, making your uterus proper. You need to do the placenta, and so there are many steps in becoming pregnant and having a baby, right? So you have to, everything has to kind of fall into place.
Yeah.
And so the issue when you have an autoimmune disorder that's not controlled, right? So we're talking most of the time when you have an autoimmune disorder that's controlled, there should be no issues with getting pregnant.
Okay.
Because you're just the same.
Okay. I said, I think that's a really important statement to make, that even if you have an autoimmune disorder, if it's well controlled, it shouldn't be a problem. So I think that's an important take.
Absolutely. Okay. And the question that we would have at that moment is, are the medication that we're giving you to control that immune system, are they safe for pregnancy?
Right.
And the good news is that there are many of them that are very good for that no problem. Okay, so that's number one. So if you already know that you have an autoimmune disorder, let's control it so that you can become pregnant if that's your wish, right? And in fact, I have to tell you, Carolina, a lot of time in my practice, I have to tell my patient not to be pregnant. I'm like, please go into a contraception method, maybe two even, because a lot of my drugs are not great if they were to have babies. So that's, that's number one. Now, if you have an autoimmune disorder that's super active, so first of all, super important. You still may become pregnant. It's like really important. So there are times where you do not want to become pregnant. Like we do not want you to become pregnant because it's not safe, right? So that's really important to realize that. But the thing that we're talking about here is infertility. And so the truth is, if you have an autoimmune disorder that's very active, you have to think of all of the fighting that's going inside your body, right? So because your immune system is saying, this should not be here. And so there is an override of inflammation in your body. And so there is all this inflammation that's created that's, is actually a normal response of your body against something that it feels is abnormal, right? But so then you have all of this energy of your body that's for this inflammation. Like the inflammation by itself can cause issues and can, ultimately we think that it can actually also cause an issue for and causes fertility problems.
Right.
So that's,
Yeah, I want to break that down into the two pieces that you did. And I'm just trying to talk back what you're saying because then it helps me to understand it. So when it comes to fertility, and I actually talk about this a lot with my patients, is the concept of this sort of chronic stress or chronic inflammation to the body. And it could be for any number of reasons. In this particular case, an autoimmune disorder, and anything that is untreated and chronic, even if you are functioning, is going to potentially have an impact on your fertility. And then separate from that is the impact of pregnancy if you were to become pregnant of these active autoimmune disorders, because some of those defense systems can cross the placenta, right? Am I correct in saying that?
Perfect. That you're going into even more detail, but I guess, that's your,
so the idea is fertility, and then the idea is pregnancy. So really, if you have an autoimmune disorder and you're trying to become pregnant, the goal really should be optimization of treatment to try and get it under control. So don't go cold turkey because you don't want the meds to affect the baby. Make sure you're working with someone who to help you tailor that treatment. Is that right?
That's exactly right. And so, and I think that that's really important is to realize that there are so many steps in having a baby, right? There is the preparation of just your system in general, the preparation of the uterus. Sorry, that's more your in your arena.
No, you're good. I always say it's really interesting just from like a biology evolutionary standpoint that human reproduction is actually super inefficient. When you think about all the things that have to happen, and even at the end of all of that, only 20% chance of pregnancy with each ovulation in a peak, in a perfect setting. Like, to me, that is mind blowing when you compare us to other animals in the kingdom. But anyway, that's a complete side note.
True. Yeah, no, that's actually, that is fascinating. I see it as something just miraculous, right? Like we're so well made. But I never compare myself to a rabbit, and suddenly I'm like, man, we're not that miraculous after all.
Exactly.
I love it.
So there's so many things that have to happen, just like you're talking about, and so many things that have to fall into place. And this is sort of one more thing that we would be talking about. So I want to talk just briefly about treatment, and I know that each disorder is going to have its own treatment, but when I talk to patients, I generally talk about medical treatment, supplements. We talk about lifestyle a lot. Integrative medicine is kind of that fourth arm that I've begun counseling a lot more about. And I want to understand sort of what is the umbrella, without going into detail of each one, what is the umbrella approach to treatment? And then what is the typical time frame for optimization, if there is one?
Yeah. So as you mentioned, it's very various. It's various on the disease. It's various on the patient, and also with the approach that your doctor has. But in general, I would say the goal always is to put yourself in balance. And to put yourself in balance, you just have different levels, right? And so if someone has very little inflammation, it's very little, we may just try plaquenil, right? Like hydroxychloroquine, because it's not immunosuppressive, but it rebalances the immune system. That's it's immunomodulator. That's how we call it. And then you go, if you need something more, you go to more immunosuppressive. And we're talking about, I don't like steroids in general, but sometimes you have to have those. But we have, biologic agents, we have DMARDs, like some medications and so on. And so really the goal of the rheumatologist here, the job of the rheumatologist is to know exactly what's happening, to know the studies in the literature, and to be like, okay, in this case, this is what I need to give. In this other case, this is what I need to give, and so on. And in addition, if they know that you want to become pregnant, then we also have this extra thing, which is like, okay, this patient wants to become pregnant, so we can use this and that drugs. But that's really the idea, is to put back your immune system in balance and give it the minimal amount that it needs to go and to quiet down while not immunosuppressing it too much.
Yeah.
Which is why I consider this an art, because it's really, how do you do this, right? Like, so sometimes it's like an educated guess, and you're like, okay, I'm going to do this because there's so much inflammation. There's a CCP. So this patient has horrible RA. I know I need a biologic. But some other time you're like, well, it's just a positive ANA with, a mild joint pain. But there is a lot, or maybe there's not even joint pain, but like ANA, patient has been having trouble getting pregnant and they have a ton of family history of lupus or autoimmune disorder. In those patients, I would be like, what's the risk of plaquenil? Very little. So let's try this, right? But did I answer your question?
You did.
Okay.
And I want to sort of do a follow-up question. So that's all really the medical treatment. And what I'm hearing from you is the same disease, different patients could be different treatments depending on their different circumstances. And so really working with someone who understands that, who can tailor that treatment. And then I wanted to bridge that and sort of add in the supplements and integrative practice. Is that something that you do or don't do? Does it help? Does it not? What are your general thoughts on that?
So first of all, I did recently a workshop on exactly this, because it's fascinating. There's so much about this. And it was super well received. So I'm going to do it again. So you can look on onaveragemd.com, and there will be another workshop on this. But that's the number one. So yeah, I absolutely am a big fan of this. Like, I think integrative and making sure that all of our mind, body, spirits are, in balance. But yeah, you're absolutely right. Depending on the patient and their presentation, right? Like, if I come with fever, not me, like if a patient comes with fever and with horrible joint pain, with swollen joint, 2-3 hours of morning stiffness, and they have like positive CCP, that's not the same treatment that someone who's coming and has, just a little bit of joint pain, not really any like antibodies that are positive, right? Sure. Both of them can still affect your fertility, because in a way that's inflammation, right? Like even a small amount of inflammation, but maybe like this other person that has a ton of it, like you don't know the whole body, and maybe they are 25, so they are their peak of fertility. Maybe that's, and even though they have like super inflamed thing, they still may have more fertility, since that's the question. But yeah, so you have to tailor everything depending on how the person presents.
Right. And so do integrative practices help or no, specifically for autoimmune disorders?
So when you're saying
like acupuncture, meditation, herbal supplements.
Oh yeah.
Okay.
Yes. So yes. Okay. I'm going to tell you this story.
Go ahead. No.
Yeah, please. No, I want you to know this, and I want your listener to know this, because it's so cool. So rheumatoid arthritis, super inflammatory. Like it's like, you know, when you're thinking of an inflammatory arthritis, that's the one. It can destroy your joint. It can actually cause inflammation of your heart, inflammation of your joint, inflammation of your vessel. You can even have it in the lungs. You can have it in the eyes. I mean, it's like the rheumatologic disorder, right? Okay. So we think that vagal stimulation is going to actually help. And so there is currently a trial, randomized control trial, where they are putting a device to stimulate the vagal nerve, right?
Okay.
And we actually think it's going to be a positive trial. We think that this thing is going to show that it helps the same way that that same device helped patients with, I think, epilepsy. Yeah. Okay. All right. Yeah. What if I told you that there are other ways to stimulate the vagal nerve? And that is the meditation, that is the, you know, breathing for your belly, that is going in cold water, etc. So all of those practices, they are working to stimulate your vagal nerve so that instead of being in this fight mode, which literally is not the best mode to become pregnant, right, you go into this what we call a parasympathetic system driven phase, and that's where you want to be to become pregnant. And so stimulating the vagal nerve is the way to go. And stimulating, I mean, yeah, you can wait until this stimulation thing arrives, but it's like a surgery. I don't know. I don't really want this personally.
I totally and the way I envision it is the sympathetic is like that person who's on the floor of the Wall Street market and they're and it's just like high stress and chaos and super craziness. And then I envision somebody like on a beach chair overlooking the ocean, and that's the parasympathetic, right? So the two comparisons and trying to take that body from the sympathetic response to the parasympathetic, and that is going to be helpful to not only autoimmune disorders, but to fertility. This is something that I've begun to explore more and more in the last year, and I think we're just beginning to dip our toe, at least in Western medicine, I think we're just beginning our toe into the benefits of these integrative practices. So
it's just incredible. You know, there's more and more studies that are, you know, backing all of those out. So just so that you mentioned acupuncture earlier. Acupuncture is definitely proven to help some disease in rheumatology, and I mean, it's, you know, at first people were like, oh, this is BS, this doesn't exist, this doesn't work. And now you're like, no, it actually is working. It does work. And it's against sham, against placebo.
Right.
So you're like, yeah, I mean, there's nothing better than that. So just, I think that someone that wants to become pregnant and has had some issues, and, you know, my personal story is that it was super hard for me to become pregnant. And not the first time, but I lost that baby. So I guess it was very hard to become pregnant, but it was hard. And I remember just like being like, where do I need to go into that space so that I get there? And it was the moment that I started doing meditation and visualization and acupuncture that actually ended up becoming pregnant. And, you know, just so interesting. Like I had done an IVF, didn't work. And this one was just stimulation because the insurance had changed, and I had to do like a round of, what is it that you do? Clomid, right? And I had twins with Clomid when the IVF didn't work.
I love that story. That's so great. But I think that is so beautiful. It's such a perfect illustration of the impact of all of these other things. And I think that, you know, in at least in our society, we're very much socialized that, oh, just give me a pill for this, let's just fix it with that, you know, and it's a very sort of medically driven treatment, where I do truly believe that all these other things that we're talking about are just as important, right? I think that's a huge thing. I think it's not highlighted enough in medicine today.
Yeah, and it takes more time, right? So like and also when someone comes to you, I used to feel really bad telling my patients that, because I felt that they thought that some of them may have thought that I was just brushing them off and saying like, oh, what you have is nothing. And I'm like, no. Like what you have is an inflammatory process for sure. We need to take care of this. And you need to do this as well, because it will help you. And to see so much research is, I started looking in visualization. So if I have like this one thing, it works for my patients, I'm going to tell it to all of your people, right? Visualize because it works. Visualize. And the thing is that there are studies that are super well done in rheumatology that show that visualization helps heal the joints.
Wow.
It decreases the inflammation. You don't need as much medication at the end than the group that has not done the visualization. And they looked at that. And I remember like looking, because I wanted to do a research on that. And then I'm reading all of, to do the background. I'm reading all of the studies, and I'm reading meta-analysis. Meta-analysis has like, for your people, they have big amount of studies of the biggest, best studies, right? Like, so like this is the level, like there's not better level of evidence. And there are meta-analysis of visualization in rheumatoid arthritis. And then I was like, okay, that's it. I'm prescribing this to every single of my patients. And there's nothing better than feeling better. So, right, like you can imagine that you have no more joint pain. Right. Just imagine how would you feel, what, and do this with, I'm sure, I wonder if that's been done in fertility, because that's not my specialty, but I mean, it's not going to hurt. That's all I can say.
And that's always my endpoint, right? Is it's not going to hurt, it's low cost, and it might help.
Yeah.
So kind of why not? And I love the term integrative or complementary in the sense of it's not an either or. It's not you have to choose this or this. No, you have a medical diagnosis. You need this treatment, but this also needs to be part of your treatment plan. And I love that concept. So I want to touch very, very briefly. I know we've been on for a little bit here. Just very briefly talking about antiphospholipid syndrome. If you can just define it, what it is, and then sort of the rheumatologist take on it. Because I know I deal with it every day on the OB sort of health side, but sort of the rheumatologist take on it.
Okay, absolutely. My pleasure. I want to just respond to one person that asked about Hashimoto. I would say Hashimoto is a thyroid disorder, so it's more an endocrinology issue. So I think you will be better served by an endocrinologist, but I would say that the concept of an autoimmune still works in the sense that it's autoimmune. So, you just want to make sure that you're doing all of those things that we're talking about, integrative medicine, in addition to working with your endocrinologist. So anyway, having said that, to make sure that all the questions are answered, antiphospholipid syndrome. So it's a syndrome that can be really like awful, like life-threatening, right? That's one of the syndrome that we are afraid of having to deal with in rheumatology, because you have to be very quick at times, not all the time, but at times, right? There's not a lot of emergency in rheumatology, but that will be one of them if there is something called catastrophic antiphospholipid syndrome. So it's a syndrome that's that's autoimmune, and the autoimmunity and the way it presents is that you're going to have clots and thrombosis. And so you're going to develop clots, sometimes are in your artery, sometimes in your veins, right? And so you can have pulmonary embolism, you can have clots in your brain, you can have clots everywhere. And the way you diagnose that is that you can have, it's probably microclots, right, in the placenta or something. So you're going to have like pregnancy losses. And so the criteria are you have to have a certain number of pregnancy losses plus the antibodies. So you have like a bunch of criteria. So there in this, it's like pregnancy loss, clots, and so on. And then you have those antibodies, and the antibodies have to be found twice, 3 months apart. So it's not an easy diagnosis to make, except if the patient is obvious, right? Like, except if you have had like 12 miscarriages before 3 months or 4 months, and you have those antibodies. But I would say that more so than none, there are those antibodies that are positive, and they don't actually mean that you have, like I spend more of my time reassuring people than actually telling them that you have an antiphospholipid syndrome. In fact, I want to say that it's probably the least common autoimmune disorder that I have to deal with in my practice. It's possible that they go to hematology, but just in general, it's really not that common. And you probably see that a lot more because that is a cause of infertility, like of not being able to keep the baby in.
Pregnancy loss,
Yeah.
exactly. Yeah.
And then you check the
Loss,
antibodies.
right. In our world, it's such a frustrating diagnosis because 80% of the time it's diagnosed as idiopathic or of unknown origin. So very, very frustrating. So when we can find an antibody, I think as OBGYNs or as fertility specialists, we hang on to that because we want an answer. But it definitely, that makes sense. That's super helpful. Okay. So I have taken up enough of your time. I'm so grateful to you for being here. So tell me, where can people find you? Where do you practice physically and virtually?
Oh, thank you so much. No, it's been such a pleasure. It's such, this is so important. And I completely understand. Thank you for doing this for your patients. I wish I had that when I was trying to have babies. So
I feel for me, these lunch and learns are so important because the more knowledge you have, the more questions you know to ask, right?
Yeah,
so I think that
absolutely. Yeah, no, that's great. So I'm Isabelle Amigues. I'm a rheumatologist in Denver, Colorado, and I can see patients virtually in Colorado, Wisconsin, and Michigan, as I have licenses there, but mainly I'm in Colorado. And I'm opening literally tomorrow. Not tomorrow, Monday. Monday.
So
Yeah, and so I'm subleasing for now in Denver, but then later on in March I should have my brick and mortar. And we are the first direct care rheumatology. So I'm super excited because we're going to bring all of this integrative approach to caring for our patients. And I know my patients are very excited as well, and having the time and the energy and like bringing this to the patients. So that's my passion, really.
I'm super excited for you. So thank you so much. I will say for anybody watching this, if you do have questions for me or for Dr. Amigues after today's visit, feel free to send the questions. You can DM her, you can DM myself. We'll turn it into, a reel or another live or a podcast episode or something. So we'll be happy to answer questions. It won't be medical advice, but it will be appropriate educational information for anyone who needs it. All right, guys? So Dr. Amigues, thank you so much. I really appreciate your time.
Thank you.
Enjoy the rest.
Thank you so much.
Have a great weekend. Bye-bye now.
Thank you. Bye.